A little trouble logging in, but we're good.
Okay. All right. Well, good afternoon. I'm going to introduce myself and then I'll let Megan introduce herself. My name is Ashley Godwin and I am a speech therapist at Child and Family. Megan, if you want to introduce
yourself. Yep. And I'm Megan Davidson Palmer. I'm an OT at Child and Family Development.
All right. Well, welcome to the Picky Eating webinar. We're so glad you could join us. So today we're going to talk a little bit about the difference between a picky eater versus a feeding problem and when to seek treatment. And we also are going to talk about how to manage your child's picky eating with strategies that we'll give you to help make mealtime less stressful and more successful. And if you do have questions, if you'll save them until the end, you can chat us and we'll try to answer them in the order that we receive them. We are going to have time at the end set aside for questions. So let's go ahead and get started. All right, let me share my screen and we will. All right, give me 1 second. All right. Okay. All right, so let's first talk about age-appropriate picky eating characteristics. So these are kids these are your typical kids. So they just are picky eaters. We hear about this all the time. And this includes a limited variety in their diet, but they eat at least 30 different foods. They eat at least one food from each nutrition group. And the nutrition groups are carbohydrates and starches, fruits and vegetables, and those are actually in the same group. So if you are thinking to yourself, well, my child doesn't eat any vegetables whatsoever, well, if they eat some fruits, that counts as one of the nutrition groups. And also proteins. And even if your child doesn't eat meat, dairy is included in that protein group. So if they eat yogurt or cheese, you're good with that. Okay. They eat at least one food from each texture group. And by texture groups, we mean purees, such as yogurt or baby food, mixed textures, such as macaroni and cheese, spaghetti, soft table foods, and that would be bananas, muffins, that type of thing. And the last one is hard mechanicals. Those are things like chips and pretzels. All right, tolerates novel foods on their plate, and they're comfortable at least touching or tasting the food. Frequently eats different foods than the rest of the family during meal times. And if they become sick of a food they eat frequently, they will usually return to this food after a short break, so about 2 weeks. So if you're giving your child chicken nuggets every night for dinner, because that's one of the only things they'll eat, and then all of a sudden one night they're like, I'm not eating that. Usually if they'll pick it up about 2 weeks later, that is the sign of a picky eater. All right.
All right. And sometimes it's hard to differentiate between just age-appropriate picky eating and when there might be a feeding problem and it's appropriate to seek treatment. Characteristics of a feeding problem, there's a history of picky eating. So, there are well-child checkups throughout the years. You've always noted that they're a picky eater. It's been a problem over time. They typically have fewer than 10 foods in each of the food groups that Ashley mentioned on the other slide. So starches, carbohydrates, fruits and vegetables, and proteins. Again, it's meat and dairy. So if they have fewer than 10 foods in those groups, they may have more than 10 in one group, but if they've got only one or none at all in one of the other ones, we would consider that more of a feeding problem versus just typical picky eating. Weight loss is another sign of a potential feeding problem. Choking, gagging, or coughing when they're eating, frequent vomiting, some like problem feeders. There's a history of this when they're younger. Trouble transitioning from breastfeeding to purees or bottle feeding to purees. And then again, with the transition from purees to solids, they may have had difficulty in those early stages. if you have an infant who cries and is arching their back a lot at meals, there may be some reflux going on, even if they're not throwing up. Could be silent reflux, just another characteristic of feeding problems. And they may also have aversion or avoidance to foods. It may be a specific texture, maybe a variety of textures, or they may be avoiding an entire food group. Like maybe they have no fruits and vegetables or no proteins. So just some signs to look out for that help differentiate between age appropriate and more of a feeding problem. And then some other signs of potential feeding problems are if they're having trouble staying still at mealtime, getting up, running around, moving away from the table, having outbursts or tantrums whenever a new food is presented, just complete refusal to try new foods. These are the kids that are not willing to just, take a bite and move it to the side. There's usually, they tend to get very upset when presented with that food. They may refuse foods that are difficult to chew. You may see them kind of leaning towards those easier to eat foods, like purees, things that kind of like melt or dissolve in their mouth, and they don't have to chew as much. They may only eat a specific brand of certain foods. This is what we call brand specific. Whether it's like only one type of mac and cheese, or they like a certain granola bar, but they will only have that flavor and only that brand. Even if you get something very, very similar, they're pretty set on that brand, and it's just hard to branch out with different options of the same food. They may also only like the food prepared a certain way. So if you change it slightly, even if it's not a very noticeable difference to most people, they might refuse it altogether. Another characteristic is that they stop eating foods that they previously enjoyed. And sometimes that's with the foods that they've kind of like burned out on. If they're eating it all the time, they just get sick of it. But those foods aren't necessarily gained back after a 2-week break. And another thing, they are usually eating a different meal than the rest of the family. So you're cooking or you're preparing something separate for them during most meals.
Okay. Let's talk about some of the most common causes of feeding issues. Okay, so pain or discomfort. That can be gastroesophageal reflux, vomiting, gagging, sore throat, GI pain or discomfort. That could be constipation, nausea, food allergies, a serious illness, especially respiratory, cardiac, or renal conditions, and medical procedures. And immature oral motor or swallowing skills. So this would be kids with low muscle tone and decreased strength and mobility of their tongue and jaw. So that can actually result in immature chewing patterns, which can create a problem with feeding. Overstuffing, so kids who take a bite of a muffin and they don't stop there. They keep taking bites until their mouth is just entirely full. Difficulty coordinating breathing and chewing and swallowing. Choking and aspiration. Those are all some immature oral motor and swallowing skills. And aspiration is when food or liquid actually penetrates into the lungs. Megan, if you want to talk a little about sensory processing differences.
Yes, yeah. And we'll get into this more in some slides coming up, but just a quick overview. So eating it requires integration of lots of different types of sensory input. So if there are some differences in sensory modulation, like the way they're processing the input, feeding can just be a very overwhelming experience for a lot of kids. And if there are issues with sensory discrimination, like being able to tell the differences, different textures, tastes, colors, how it feels in their mouth, it can just be very challenging for them. There's also sensory-based motor difficulties that could impact it, like decreased body awareness. And we'll talk more about this in a few slides, but like trouble staying in their chair, things like that. And then also difficulties with interoception, which is just processing like internal hunger cues and being able to tell if you're full, things like that. So if there are difficulties in that could be impacting a feeding problem. And then other factors are learning or behavioral delays. It may be a cognitive delay, or they may just be at that point in development where they're transitioning like from one cognitive stage to the next. And then another factor is the nutrition aspect. Metabolic disorders, absorption disorders, if they're not absorbing the nutrients as they should be. And then that's what I had for nutritional factors.
All right.
All right, so for the sensory piece, we'll go a little bit deeper into this. Just eating requires the integration of lots of sensory inputs. You've got the visual input, olfactory, which is a sense of smell, tactile, a sense of touch, gustatory, which is a sense of taste, auditory, hearing. Proprioception is body awareness, so it lets us know where we are in space, and vestibular movement. And then again, that interoception, like those internal hunger cues, appetite, being able to tell when we're satiated or full. So kids are processing all of that when they're eating. And if there are sensory processing difficulties, that can be a lot. It's a major sensory challenge. And then do you have the next?
Yes.
Thanks.
No problem.
So again, we'll talk a little bit more about the sensory modulation. So that's just the nervous system's ability to organize the sensory input that we're receiving and to respond appropriately. So kids that are over responsive, it's one of the sensory processing patterns. These children notice sensory input more easily, and they're actively trying to avoid something that they find uncomfortable or aversive. So it could be taste, textures, like little differences that some people just may not notice, or they may notice them but aren't bothered by them. So we just call over responsive to that sensory input. And then you've also got kids that are under responsive. So some kids may not register certain sensory input as easily as others. And these kids usually require more intense amounts of the sensation. Like they might need chewier, crunchier foods and something with a more a bolder taste, like spicy or sour, in order for them to like really process it and respond appropriately to that one.
All right.
Yeah, whenever you're ready.
Okay.
Okay, and then sensory discrimination, just being able to discriminate between different types of sensory stimuli. And so, again, some kids notice this much more easily than others. Texture, taste, if you mix something, a novel food with one of their preferred foods, like vegetables, trying to like hide it in something, these kids pick it out really, really quickly. The kids that are over responsive to this input, whereas if we're under responsive, we might not notice it as much. But if you're not noticing it as much and you can't discriminate those little differences, it can make eating feel unpredictable and difficult to manage. And actually, Helen, can I?
Yeah, sure.
I want to go back just back to the sensory modulation one with like the over and under really quick. Yeah, that's perfect. I just wanted to add a couple more things, just examples of what that might look like day to day. So for the kids that are over responsive, looking away from their food, closing their eyes, they may be covering their nose or turning away from the food. You might see them like quickly try to wipe something off their hands. Like if they get like yogurt or applesauce, they might quickly wipe it off and just not want their hands covered in food. Gagging, covering ears while eating really crunchy, noisy foods. And then some of the examples for under-responsive, this for overstuffing, like stuffing a large amount of food. We often see this with kids that are under-responsive to input, just because a larger amount of food, it doesn't require highly skilled oral motor movements. It's just easier for them to manage, and they have a better sense of where it is in their mouth if it's a bigger piece. So we may see overstuffing can be a sign that they're under responsive to sensory input. They may also pocket food in the side of their mouth, just kind of shoving more in before they've actually chewed and swallowed the bite they've already taken. And some kids will just swallow the food before chewing it all the way. These kids just have trouble keeping track of where food is in their mouth. So if you think of like something crunchy, like a chip or a cracker, if you bite into that, it kind of breaks into little pieces and kind of goes all over your mouth. And, if you have adequate oral motor skills, you can move it around with your tongue, get it to your back teeth to chew it up and swallow it. But if you don't have, if you're not processing that input correctly and you don't have the right oral motor skills, it can be unpredictable and difficult to manage. And then one other thing on this part is they may be over responsive in one area and under responsive in another. So it's not like black and white. It's actually pretty common for them to be mixed. You might see it with different things. So the feeding approach that we take here is the SOS approach, the sequential oral sensory approach to feeding. And it really focuses on the just right challenge. It's a gradual stepwise approach, starts with just tolerating food, in the room even, and then like on the plate. And, there are several steps to get up to actually eating it. But we want to present the sensory input at just above their current comfort level. So if they're currently tolerating it on their plates, the next step would be just slightly above that, like seeing if they can touch it. And if they can't touch it with their hands, maybe using a utensil. So trying to go like just right above their comfort level so that it's challenging enough, but not overwhelming, and they can be successful with it.
Yeah, and if I can just add that, like Megan was saying, if they can touch it with the fork, and then we go up another level and see, can they touch it with their hands? And then if they can do that, we keep moving up kind of the steps to eating until we kind of reach that point where the child tells us, like, I've reached my limit. And we praise that. We praise what they have done, because we always need to remember to meet the child where they are and see that as a great accomplishment. All right, so let's talk about some of the oral motor aspects of feeding. So low muscle tone. What is low oral motor muscle tone? Those are muscles that we kind of describe as floppy. So they may need to put forth more effort to get their muscles moving properly when they're doing something. And we talk about low muscle tone, PTs, OTs, throughout the whole body, but when we're concerned with feeding, we're talking about the mouth. And children with low muscle tone often kind of have just like a flat affect into their face. They also may have difficulty maintaining good posture when they're sitting. So this is the child that's always slouched in the high chair or leaning backwards. And if you don't have good posture support, then that is not going to help you with your eating. Decreased jaw strength. So they can't adequately break up the food that's in their mouth, especially the crunchier the food or the chewier the food. And when you can't break up the food properly and you go to swallow it, what's going to happen? You're going to gag, you're going to possibly vomit, you could choke. So these are, if you can't chew up a carrot and you go to swallow it, you can only imagine how scary that is. And you're only going to allow that to happen 1 or 2 times before you're going to say, nope, carrots are not in my wheelhouse. Immature chewing patterns. So these are kids, we notice they have like a munch pattern of chewing, which is the jaw just goes up and down, where we have a rotary pattern. So kids that do not have feeding difficulties or adults we have a rotary pattern of chewing, which is kind of like a more of a round type motion rather than just up and down. Or they're using their tongue to mash their food to the upper palate. So you give them a banana and they're not moving it onto their molars. Instead, they've got it on their tongue and they're just pushing it up to the top of their mouth before they go to swallow it, not using their teeth at all. And then, like I said earlier, just not maintaining a rotary style of chewing. So they might do it a little bit, but then they go back to that old munching pattern. And then decreased tongue mobility. So we use our tongue when we're eating to move our food to our molars so that we can safely chew and swallow it. But if a child does not have the ability to lateralize, that's what we call moving the food to the side, their food's to the left and right molars, then they are not going to be able to safely chew it and swallow it. And you might see more of that mashing food to the upper palate. So let's talk about some activities to increase oral motor awareness and strength. And the great thing about these activities are these are things that kids love to do and things that we already do a lot of. But these are things like blowing bubbles with a bubble wand or through a bubble straw. That will really increase lip strength and cheek strength. Chewy foods, if they can safely manage it, like fruit leather or fruit chews, licorice, gum, even some gummy snacks that are harder to chew. Licking lollipops or popsicles. We can work on tongue strength with that and tongue mobility. So putting the lollipop over here and having them have to reach over to lick it. Those are all good activities. And finally, using a vibrating toothbrush or a vibrating sensory toy. A lot of those baby teething toys vibrate. Those can also increase oral motor awareness. Okay, so let's talk about some challenging behaviors. So challenging behaviors around meal times can be a child's way of communicating that they're struggling with some aspect of food. So here we have, crying, tantrums, refusal to eat. These are all different ways that children are communicating with us. They may find one or more sensory properties of the food may be aversive. So that's kind of what we were talking about earlier. So is it the texture? Is it the way it feels in their mouth? Does it make them feel uncomfortable? Are they lacking the oral motor skills that they need to effectively manage the food? That could create some behavior, like what I was saying. If they can't adequately chew that carrot or that pretzel rod, then they're not going to want to eat that anymore. And then also just having trouble staying still in their chair. This could be due to decreased body awareness. So they don't know where their body is in space. Difficulty with balance or posture, kind of that low tone that we were talking about earlier. And then they may have a need for increased movement and have difficulty sitting still. So they may, seek movement. And when you sit them in a chair, especially a high chair or a booster chair where they are strapped in, that is not going to go well. You will see some challenging behaviors result from that.
Okay, so we'll go through some tips for making mealtimes less stressful. One thing that is helpful is to have a consistent, predictable routine. So as much as possible, having a beginning, middle, and end. So some kind of warm up, whether it's a sensory warm up, at the very least, a verbal or a visual warning or like a heads up that it's time. A transition activity such as washing hands, singing a song. If it's a kid that needs more motor input, you can march to the table or do animal walks, but some kind of predictable routine. And then kind of in the middle, do like the family style serving, model eating different foods, just kind of have the foods there, served alongside their preferred foods. And you can model eating them without pressuring the child to try it too. It's there, but they don't necessarily have to. And then having a predictable end, some kind of cleanup routine. They can take a piece of food they've tried, and if they didn't want it, throw it away. If they're old enough, help clear the dishes. wash hands afterwards. Another thing is eating in the same place as much as possible. For certain kids, this is helpful. So yeah, offering preferred foods alongside the novel foods, usually like at least one preferred food, so that they have something they feel like they can eat during that meal time. You can, in addition to modeling eating the new foods, you can use words to describe how they feel. Like, are they chewy, crunchy, squishy? Talk about the color, the size, the shape. And then you can also offer solutions for the parts of that they're uncomfortable with. So if it's wet or squishy and they tend not to like that texture, we can dry it off, just kind of like pat it with a paper towel, wave the smell away, things like that. Let's see, I think that was most of that.
Okay.
Yeah, using utensils too, if they don't want to touch it. I know we already talked about this, but using utensils to make them more comfortable.
Yeah. All right, so we talked about using a learning plate or an all done cup. So a learning plate is a plate that is kind of to the side, and that is not the plate that they're expected to eat from, but they can make a choice of what they want to do with the food on that plate. So if you're passing around broccoli, family style, like Megan was talking about, and the child does not want broccoli on their direct plate in front of them, they could put it on their learning plate, and you guys can talk about what the child wants to do with it. Look, it's on your learning plate. Would you like to smell the broccoli? Would you like to touch it? Do you want to kiss it? So the learning plate kind of takes off the stress of like the food on the plate in front of them. And an all done cup, Megan, if I kind of say sometimes we could have it there if the child wants to try it, and then they could spit it out into a cup.
I have that too.
Yeah. Because I know spitting out is kind of bad manners, but with feeding, the child needs to know that if they put it in their mouth, they have an out, because the child's not going to try anything if they know they're going to be forced to swallow it. So we like to give them an all done cup to spit it out in case that's something that they are not ready to swallow yet. Megan talked about earlier serving meals family style, and everybody puts a little bit of everything on their plate without the pressure to eat their foods. Using key phrases, that's a big smell rather than that smells bad, or that's a really big taste rather than it's really spicy, or that tastes gross. Using words like that can help. And then using phrases like you can rather than can you do this. You can touch that food. I know you can. And offer a suggestion for how they can interact with food. And I kind of talked about that earlier. For some kids, try eating in new places. The table can kind of be a stressful place for kids with feeding difficulties. So try eating outside. It's springtime now, it's beautiful. Have picnics or change the seating arrangements at the table. Let them pick out new mats or fun kid-friendly plates. And then be patient. This is probably the biggest thing. I can't reiterate enough. You have to be patient. It may take 10 or more exposures to a new food before your child is even ready to touch it, nonetheless put it into their mouth. Remind them that it takes at least 10 times to eat a food to determine whether or not they like it. So if they put it in their mouth and they're like, I don't like that, you can tell them, we need to try it a couple more times before we can really decide whether or not that's a food that you don't like. Offer choices that you're comfortable with. Children like to feel like they are in control. So if you want your child to have a healthy choice, but they want something else, you make the choices for them, but you have to follow through with whatever they choose. So if, the choices are raisins and candy and they choose candy, well, you need to follow through and give them the candy. But if you don't want candy to be a choice, then don't give them that option. And then, like Megan was saying, use words that describe the properties of food, such as chewy, crunchy, squishy. And then let's talk about involving children in meal prep. Have them assist getting ready to eat by washing the food, cutting and chopping the food. You can give them a plastic knife and have them, cut the boiled potatoes or softer fruits and vegetables. as is age appropriate. Let them pour and stir and mix ingredients, because even if they're not eating it, they are really involved in the smell, the touch. And when they're cooking, you're not sitting there saying, try this, try that, try this, take a bite, take a bite. So it's fun for them, and they're associating something pleasurable around these new and different foods. It's also exposing them to, mixed smells and mixed textures and that sort of thing. So this can help increase their comfort level with the food, even if it's not going in their mouth, because there's a lot of steps to eating before it actually gets in your mouth. Some kids can't even tolerate being in the same room as a food. So we have to, I kind of talked about this earlier, we have to praise them for what they can do, even if it's a small thing. And I know it's all of our goals to have the child eat and swallow the food and, it be a preferred food, but we're not always there with foods, and we need to be patient. So if the child is willing to smell it or give it a kiss, we really need to praise them and tell them, great job. You kissed it. I'm so proud of you. We want to keep the mealtime as pleasurable as possible for everyone involved. Megan, is there anything else you wanted to touch on before we kind of move on to questions?
No, I mean, I think that the meal prep, like involving them as much as possible is great. And I think the next slide, we'll talk a little bit more, just like how that's good from a sensory perspective too. And just, it still counts as an exposure to the food. So even if they're not eating it.
Yeah.
Yeah.
I think next. Okay, here we go.
Okay. Yeah, it should be hopefully the next two.
Okay.
So other sensory activities to help kids get more comfortable with the food and kind of explore it at their own pace. Like they may get some of this with the meal prep because they're touching the foods. You can finger paint with purees, and even if they're not quite ready to touch it with their fingers, you can start with the utensil and then just kind of gradually work their way up to it. I've had a lot of kids where they'll get it on their finger and then just randomly decide to lick it. And
yeah,
even after they've told me they are not going to touch that food, they end up touching it and then licking it. And okay, it's not so bad. There's a lot of recipes out there. If you do a quick Google search or something like on YouTube, even edible Play-Doh, because then you've got a lot of good tactile input. You've got visual input with different colors. It's a fun activity. They don't have to eat it, but they can if you pick the edible kind.
All right.
And I think there's a couple. Okay.
Yeah.
So building with foods, using toothpicks to connect different foods to build shapes, or building a tower. Just to get them involved and get them manipulating it, because again, those are all exposures to foods. It's increasing their comfort level and allowing them to explore the food at their own pace. So we always encourage food play of all sorts in here. Some kids like to dissect the food with however they want to do it, and you just I kind of like will give them some suggestions that kind of steer them in a certain direction, but I like to see what they do with it and then kind of take their lead with it. You can use cookie cutters to cut shapes, or fun utensils with different colors or animals, or even bring some of their toys into the play. Their little people or construction vehicles, cars, anything like that, just to manipulate the food in different ways. And then that's like mostly tactile and tactile activities, but just a couple more examples of other sensory activities. Sorry. No, it's okay. I put this one on, but other sensory activities, we talked about doing like gross motor activities for especially for the kids that have trouble sitting still during meal times. But it can be good, even if they're not having trouble sitting in their chair, it can still be good to have those sensory activities in the beginning, because feeding is just a major sensory challenge. So offering sensory activities in the beginning can just kind of help organize their sensory systems and get ready to eat. So things like animal walks, like pushing, pulling, carrying something heavy, that like heavy work that we talk about that gives them that good body awareness. Jumping on a trampoline, something like that, prior to meal times can be helpful.
Yeah. I've heard setting up an obstacle course.
Yeah,
I've heard parents doing that. So they'll start in their living room with tunnels and couch pillows, and it will lead to the kitchen table.
Yep. That's a big one. I'm glad you brought that up.
Yeah. I've always thought that was a fun one.
Yeah, the obstacle courses are big.
All right. Is there anything else that we have before
I think that's
we
all
move
I
on?
got. Yeah.
All right. So we are going to open it up to questions. So does anybody have any questions? I know that was a lot of information. So if you want to just chat, and if you do have questions, we will try to answer them as quickly as we can. We'll give it a second. Let's see. All right, let's see here.